Well, before Barack Obama, another U.S. president and First Lady made the health of Africans a major priority. Joining us now is our health correspondent, Linord Moudou, with the story. Welcome, Linord.
Thank you, Vincent. Hello, everyone. Well, next week on July 2nd and 3rd, the George W. Bush Institute is convening an African First Ladies Summit in Dar es Salaam, Tanzania, with the theme, Investing in Women, Strengthening Africa. The health of women is a key issue for former President Bush and Mrs. Laura Bush. Last year, they renovated and opened the Ngugu Health Center in Kabwe, Zambia, to serve as a cervical cancer screening and treatment center. And through the Bush Institute, the couple is working with healthcare providers to save women from cervical cancer and breast cancer in the developing world. Now,
Lady's life has been saved from AIDS but dies from cervical cancer. And so starting in Zambia, the Bush Center, along with our partners, are going to put on a cervical cancer crusade to save lives. As many lives as we possibly can. And we're starting here today at this clinic.
And joining us now is Jim Glassman, Executive Director of the George W. Bush Institute. Mr. Glassman has worked as a journalist, publisher, and author, and served as chairman of the Broadcasting Board of Governors, which oversees VOA. Mr. Glassman, welcome to Africa 54.
Thank you so much.
It's so good to have you here. First of all, let me just say that President Bush and Mrs. Laura Bush are scheduled to be in Africa before the summit. They will be renovating yet another clinic. Tell us about that. Why is it important to focus on putting these health centers ready for women to go there?
Well, first of all, the disease, cervical cancer, kills hundreds of thousands of women in Africa every year. And it is completely preventable. It's treatable. And so we decided to set out with our partners, and we have terrific partners, to diagnose and treat in the early stages cervical cancer. So women across Africa really need to be aware that this is a disease that they don't have to die of, that it can be treated.
And what type of services are offered in the center?
Well, what we're doing in our effort, which is called Pink Ribbon, Red Ribbon, so pink ribbon represents cancer and red ribbon is AIDS. We're building on what the United States government has done over the last 10 years in fighting AIDS in Africa through what we call PEPFAR, the president's program that President Bush set up 10 years ago. And there are clinics now in Zambia and Botswana, and we will be adding several other countries. We'll be making an announcement in Dar es Salaam next week about the next country. And there will be there already are dozens of clinics. And thousands of women have now gone through these clinics. And it was interesting that President and Mrs. Bush last year, as you said, helped renovate a clinic. They're going to be doing the same thing in the next few days. And what that does is not only does it make a clinic acceptable to do this work, but also it attracts a lot of attention so that women throughout Zambia and other parts of Africa become aware of the importance of treating cervical cancer.
Now, the Pink Ribbon, Red Ribbon initiative was launched a couple of years ago with an $85 million commitment across 5 years. What type of impact have you seen so far with the money that has been disbursed?
Right, we've already begun to have an impact. It takes a while to get a project like this up and running. We've only been doing it a little over a year. It's run, the executive director is a wonderful woman born in Nigeria, an MD named Doyin Olawale. Yeah. And we have great partners, including UNAIDS, Susan G. Komen for the Cure, the U.S. government, of course, and a number of pharmaceutical companies that have joined in this effort. So we're already beginning to see the effect where you have, let's say, out of every 1,000 women who go through these clinics, we are finding that about 250 to 300 of them are infected with the human papillomavirus. We are able to treat them in the early stages using a very simple chemical. They're able to be diagnosed and treated the same day, so they don't have to go far away and come back. So it's beginning to work. There's no doubt about that. But we want to make this a much larger effort. And I also want to add that it is the governments in these countries, the government of Zambia, the government of Botswana, the government of other countries we're going to be dealing with, that is really the backbone of doing this. This is not like a kind of charity operation.
Yes.
These, the health ministries have done a fantastic job in these countries.
Now, let's talk about the summit quickly.
Yes.
As you reach out to the First Ladies, what are some of the anticipations or expectations that you may have in terms of working with them and the role that they will play in the long run in their countries?
Well, first of all, I just want to say that there are 9 First Ladies who already are confirmed for African First Ladies, and in addition to that, Mrs. Bush will be there, Mrs. Obama will be there, Cherie Blair, the former First Lady of the UK, will be there.
Yes.
So what do we want them to do? Well, it's really up to them. We want to give them the tools so that they can do the kinds of work that Mrs. Bush, Mrs. Obama, Mrs. Blair have done in their own countries. And that means learning about what are the most effective ways to help in the healthcare sphere, in education, in entrepreneurship, in agriculture. Those are the areas that this conference is going to encompass. And by the way, I also want to say the conference is co-sponsored very generously by ExxonMobil, which is really concerned about health in Africa because, frankly, it's helpful to them for Africans to become more wealthy, middle class, and healthy.
Okay, Mr. Glassman, that's all the time we have. Thank you so much, and
thank you.
We wish all the best to the conference and to the Bush, George W. Bush Institute.
Thank you.
Thank you so much for being here. And that was Mr. Jim Glassman, Executive Director of the George W. Bush Institute. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.